Okay, AlexAnn, I just got the word. It's working. We are streaming live on Facebook. Good
Yay.
morning. Oh, I know I'm not the only one that has these challenges, even though we use this platform a million times. So good morning, everyone. Thanks for your patience. I am Lori Trieger, candidate for Lane County Commissioner, and I'm really excited to welcome you to another Sunday morning candidate coffee. And I have a special guest this morning, AlexAnn Westlake. And I'm going to share a little bit with you about what we're going to talk about and read an introduction for AlexAnn. And then she and I are going to have a conversation. And I'm glad anybody watching is with us live. You're welcome to drop comments in the video, and we'll answer questions if we can. And we'll also post some links as the conversation goes. And please know that these candidate coffee videos live in the video section of the Elect Lori Trieger Facebook page after we're done the live broadcast, and we upload them to our YouTube channel. So if you don't catch all of it, you can watch later, or if you know someone you think would like to see the conversation, you can direct them there even after the fact. So again, AlexAnn, thank you so much for joining me this morning.
Thank you.
The purposes of these candidate coffees is really for me to have a chance to talk with folks in the community and to share with community some of the issues I care about and why. And AlexAnn is a local midwife. I'll read her introduction in a minute, but she's the executive director of a new, in the process of launching project, Our Community Birth Center. And this is so important to me for a number of reasons. As a county commissioner, we are the public health authority, and the rates of childhood and maternal mortality, morbidity, and other health outcomes are really critical indicators of the health of a whole community. And so I'm especially interested to talk to AlexAnn and to support the work of our community birth center from that perspective. But on a really personal note, this past Friday, 2 days ago, was the 34th birthday of my first baby, my daughter. I also have a son who came along almost 4 years later, and both my children were midwifed into this world. And I have such high regard and respect and admiration and appreciation for what midwives do. My daughter is also now a mama herself. She's the mother of my twin grandsons who also were midwived. And my son-in-law's mother is a doula in this community. And so these issues around birth options and safe, supported, healthy births for all mamas in all settings is just really important to me as someone who cares about public health, but also on a personal level. So I'm going to introduce our guest, and we'll have a conversation. This morning joining me is AlexAnn Westlake. Her pronouns are she, her. AlexAnn was born and raised here in Lane County, graduated from the U of O, and went on to become a certified nurse midwife through Oregon Health Sciences University in Portland, OHSU. Midwifery is far more than a job for AlexAnn. It's a huge part of her life, and she's extremely passionate about it. She's overjoyed to be working as a midwife right here in her own home community. AlexAnn has experience working in a number of settings: clinics, hospitals, freestanding birth centers. She's had the honor of catching 434 babies so far in her midwifery journey. In 2019, our community's only freestanding birth center here in Lane County, the Nurse Midwifery Birth Center, was closed, and the entire midwifery service staff was laid off. And the subsequent outpouring of community advocacy for the birth center inspired AlexAnn to establish a new nonprofit called Our Community Birth Center. And with the support of an outstanding board of directors that includes local parents and midwives, they are moving forward on this project, and that's what we'll talk about this morning. The organization is working towards opening that center and has raised over $150,000 toward their goal. And I've made a small contribution. I'll make another one after our conversation this morning to that effort. And AlexAnn is also a mom herself of an energetic 4-year-old named Peregrine, has a wonderful partner named John, and they live in this county commission district. And in fact, I met AlexAnn, but also I knocked her door when I was out canvassing before COVID. And you can't see it because of the glare, but she gave me this I Heart Midwives pin.
Oh,
I'm proudly wearing because I heart midwives so much. So with that, AlexAnn, I'm going to turn it over to you to share a little bit more about the history of how our community birth center came to be as a project.
Thank you. Yes, I'd be happy to do that. And thank you for offering to donate too. That's wonderful. And actually, right now, all donations are being matched through the month of October. We have a $10,000 matching challenge going right now. So extra appreciated from that standpoint as well to help us reach that goal.
Great.
So there has been a nurse midwifery birth center in Lane County for over 40 years. Families have really come to rely on this option and trust this option. And the very first birth center in Lane County was in Cottage Grove, and it was actually one of the earliest freestanding birth centers in the country, in the US. And so that was over 40 years ago. Eventually it transitioned to Eugene. It was in downtown Eugene and had a couple different sites there. And then when Riverbend was built was when they moved the birth center over to Springfield. And for those who haven't seen it, there's a lovely facility over on Deadman Ferry Road that was the former birth center, where I worked for a few years before it was closed down. And that birth center has had a huge impact on me as an individual and also on our community as a whole. There were over 1,000 babies born just at that newer facility, birth center facility that was built 10 years ago. And so, and that was, I remember when I was a student graduating from the U of O, and I went to the grand opening of that birth center facility as just finishing undergrad. I had a degree in Spanish, and I knew I wanted to become a midwife. And I went and saw this opening of this new birth center. It was so inspiring, and I knew I wanted to come back and work there. So when I did finally get to come and work at the birth center in 2017 was when I started there after working in some other places as a midwife first. It was just my dream come true. And so as you can imagine, I was devastated when the birth center closed last year, as were so many people in our community, thinking of the thousands of families who got care through the birth center and the thousands of babies born there. And it's not even just birth. The birth center, although we call it a birth center, there's also general health care, women's health care, family planning, postpartum support, lactation support. So there's a lot more to it than just that. And people build lasting friendships. One of our board members, Ruthie Zanwuka, she shares a story about how she met these other parents in her childbirth classes. And then after their babies were born, they kept getting together. And now those babies are like 6 years old, 5 years old, and they still get together really often. So building those lifelong friendships at that critical time in your life when you're becoming a parent is really special, and you can rely on them for support long term. So I've definitely seen that happen. So that's a little bit of a tangent, probably getting off, but as you can tell, I get really excited talking about the birth center.
Yeah, no, it's great. And it's perfect because, as you say, and I love that you're calling it our community birth center. I mean, midwifery really is a part of building community and bringing mamas and families together around that important event, but it is so much more than an event. You're right. I mean, that's why I'm such a fan of midwives, and my own personal experience bears that out. These are people that then came to our kids' birthday parties and helped, bring meals afterwards and provided so much more care in addition to attending the birth and making sure that went well. So I feel all of what you're saying.
Yeah,
Thank
so true. So the outpouring of support last year for the birth center and the advocacy to keep the birth center open, which even went to the county commissioners. So birth center parents showed up to the county commissioners last year and shared their concerns about this. And we're really happy to receive support and understanding from the county commissioners, which actually this year has led to the county commissioners gave us a $10,000 grant for the new birth center, which we're so thrilled about. And that money is going to go to remodeling a new space for the new birth center, which at this point we're anticipating opening in 2021 sometime. I wish I could say the exact date. It's making good progress, and we're actively looking for a space. So if anyone has eyes out in the community regarding spaces that are available, I'd love to talk to them and get input and help have more people keeping an eye out for a space that would be a good fit for the birth center.
Great.
Yeah, so that's
I was really happy to see, as a former member of the county budget committee, I was really happy to see that decision. There's very little sort of extra money in that process by the time the budget committee gets the budget, and the general fund is the only piece of that pot that they have to work with. But I know it was, I think it was a great decision because it was made based on the fact that this is a capital expense, it's not funding ongoing operations. And so I was thrilled to see that support.
Yeah, it was a really special honor to be recognized by our local community in that way. And it gives us the credibility to go out to these other foundations and larger foundations and to know that we have our local community support. And not only is it the Board of Commissioners, we have over 500 donors who have contributed to our community birth center so far. And the vast majority of those are local community members, which is greatly appreciated. So all of those are signs to me that yes, this was the right thing to do. Our community wants this. We're on the right path. And quite frankly, with how challenging the year 2020 has been and everything that's happened, like having this goal and knowing it's happening and it's going to happen, we're going to have a birth center again, has really given me great focus and hope for this year.
Yeah, great. Yeah, I tried to do a little promotional video for this morning from my garden, because I feel like that's such a place that exemplifies the idea of, planning for the future and hope and growth. And but my internet wasn't cooperating, as many things weren't this morning. But I think that is what is so inspiring about the idea of having a birth center, is because it is focused on future and growth and wellness. Can you talk a little bit about the importance specifically of midwives as part of our healthcare system and the difference in the kind of care they provide and outcomes for mamas and babies when they have those services?
Definitely. And for those who haven't been to a birth center before, aren't familiar, it's a space that is freestanding from a hospital and is home-like, but it is a healthcare facility. So we have emergency medications, emergency supplies for just in case they're needed, but we make it look very home-like and comforting. So people choose to come to the birth center for a variety of reasons. One of them is because it does feel like a comfortable, safe, home-like setting. So people can feel relaxed, they can feel confident birthing and trusting that their body's going to do what it's naturally made to do in that setting, but also have the peace of mind of knowing that they have trained professional licensed midwives and other staff there taking care of them, who have communication in place where they can reach out if needed and support a transfer to the hospital if needed, on the rare occasion that that is needed. So that's one of the reasons people choose the birth center. Another reason that people choose the birth center is because the research shows there's really good outcomes. So there's a study published in 2018 called Strong Start for Mothers and Newborns. It was actually conducted by Centers for Medicaid and Medicare, and they looked at participants who were on Medicaid, who were getting traditional care, group prenatal care, which is when you meet up in a group for your visits, and birth center care. And the birth center care actually had the best outcomes of all of those options. So in the birth center group, they had fewer C-sections, fewer preterm births, fewer low birth weight babies, high satisfaction of the clients, and lower cost to the healthcare system. And the main ways that birth centers are lowering costs to the healthcare system is by decreasing C-sections. And this is especially important in our local community and throughout the US. If you look at the Oregon Health Authority data, which is published online, you can look up the C-section rates of any hospital in Oregon or any birth center as well. And when you look up the C-section rates for our local hospitals, it's averages 34%. And the World Health Organization says that a healthy C-section rate should be between 10 to 15%. At 10 to 15%, you're doing the right number of C-sections, that you're preventing harm to babies, where trying for a vaginal birth could have harmed the baby or the mom. Whereas when you're over that 15%, it's likely you're causing more harm by doing the C-section, which is a major surgery. So that's really significant. And right now in particular, another reason people choose the birth center is because of the pandemic. So people have been turning to birth centers and home birth at much higher rates right now to reduce the risk of exposure and conserve hospital resources, and to be able to have that extra support that they really need right now with all of the restrictions in place and isolation and fear. Having some extra support of a midwife and having postpartum home visits like we do through the birth center is really special right now. So all that said, I'm sad the birth center has not been open during the pandemic, because I'm getting lots of calls from people asking, when are you going to be open? Are you open? I'm really nervous because of the pandemic. And unfortunately, we're not open right now, but making good progress toward opening. So those are a variety of reasons that people choose the birth center and why the birth center is so important. The lower C-section rates, excellent outcomes backed up by research, people looking for that safe home-like environment, and then in particular during the pandemic.
Great.
Another reason, yeah.
Yeah. Can you share, I'll put you on the spot. So if you don't have these numbers or information, that's great, but we can also pivot to a broader, more general conversation, which is of the 34% of births that are C-sections, who, is it clear, are there clear demographics around who is having these medicalized C-section births in that, over what we would like to see in the 10 to 15% that's clearly about health of the baby and health of the mom, whether there are disparities in who is having these outcomes where they're ending up with C-sections. And I will just say, so that you can answer it however you'd like, to pivot it to just talking generally about equity and providing care in an equitable way, and your plans for the Community Birth Center, particularly to reach out to and serve non-English speaking families, and for trans inclusive healthcare.
Yeah, thank you for mentioning that. I can't say specifically what the statistics are on who's having C-sections in Oregon, other than knowing that it's more than it should be based on kind of the what you would expect or what would be expected. So I'll have to look that up and look into it more. I'm sure there's more info out there. I know there are, but I don't have any numbers specifically memorized. I can speak to more about kind of the current maternal health crisis in the US, and also which is present here, and it's present in every community, and what our Community Birth Center is focusing on because of that. So right now in the United States, Black, Indigenous, and people of color are 2 to 4 times more likely to die around the time of childbirth than white women around the time of childbirth. And this is clearly linked back to racism and bias by healthcare providers. And not just by healthcare providers, but also the system. So hospitals were established with excluding certain people many years ago. And I know today we're not, turning people away at the door because they're Black or because they're Latinx, but still those systems were put in place in a way that is discriminatory, and that hasn't been fully dismantled. It's still there in really kind of stealthy ways where it's not obvious from the outside, or even from the inside, it's not always obvious. That said, in particular here in Lane County, we see that it's really important to offer all kinds of people options where they feel safe. So right now, no one in Lane County is truly getting to choose their best birth location because they don't have all their choices right now. You can't make a perfect, well, I don't know if perfect is the right word, but you can't make a fully informed decision when you're missing options. So without having a birth center available right now, it's really just impossible for people to make a fair, truly and evidence-based inclusive choice, because they're limited in their choices. And then that is in particular going to impact people in our community who have a history of trauma, people who live rurally, people who are on Medicaid, are Black, Indigenous, and people of color in our community, and also LGBTQ, transgender people in our community. And the reason it's going to impact them the most is because often those groups are more likely to seek out a birth center because they feel better supported in that space, and they trust they're going to get more personalized care. The reason this applies to rural communities is because some people live so far away from hospitals, they don't feel safe having a home birth, but they would love to come to a birth center. And so not having a birth center means they don't have that out of hospital birth choice.
Yeah, that was exactly my case 34 years ago. At that time, it was less than a year before we moved to Eugene. We lived in Yachats, and the closest hospital was either Florence or Newport. Either way, it was 60 miles north or south, right? So we opted for Florence because there was excellent nurse midwifery care through a clinic that we did all our prenatal work in, and then they had a couple of rooms separate from the regular hospital rooms that were birthing. So it was a birth center within the hospital. It was a tiny little hospital at that time. And I will never forget that drive, I have to tell you, in the dark, in the winter, on the coast, 11 contractions in the car on Highway 101, winding our way, because we waited as long as possible because I had the confidence, because of the care I had received, that I knew my body and I knew when I needed to go, and I didn't leave too early, and therefore risk being exposed to more medicalization of the birth. And so yes, that I just want to say, so for folks who maybe don't know, that yes, midwives deliver babies at home. My second was born at home with a midwife, but midwives need to be an option in every birth setting. So whether it's a hospital or a birth center, and even in the case of a C-section birth, midwives still have a role to play to support the mama and the family through that process.
Yes, yes. And I should say, if we're talking about the overuse of C-sections, C-sections are a very important part of our healthcare services. We do need C-sections. For that 10 to 15%, it's really important. And I actually am trained to assist in C-sections. So I've been in and assisted on many C-sections. So there is a role for C-sections, there's a role for hospitals, there's a role for obstetricians, and there's definitely a role for midwives as well in our community. And unfortunately, we don't have time to get into all the details about different types of midwives because there are 3 different types of licensed midwives in Oregon. But if anyone would like to reach out to me and learn more about that another time, we could talk more about that.
Great, thanks. We'll make sure to get contact information in the comments too. But I didn't mean to interrupt. You were talking about your sort of commitment to and your plans for having equitable, accessible services at the new birth center for serving all folks in the community who might want that.
I think this is really important, in particular important to have access to Spanish interpretation. And beyond that, really our goal would be to have culturally matched staff. So healthcare providers or other staff that are culturally matched with people in our community. So we are really excited to be in a place where, because we're new and we're just starting the organization, we can develop and really plant equity and inclusion into the roots of the organization. And so we're doing that now before we even hire for staff. I'm a full-time volunteer executive director right now. So once we get to the point of hiring staff, we can have those principles in place right from the start, which I think is going to serve the community really well ultimately. And the first step we're taking right now is to do a series of focus groups. And those are still in process. So by going to our social media pages or our website, people can sign up for one of our focus groups. And we're running a focus group specifically for people who live rurally, LGBTQ community members, Black community members, Native American community members, and Latinx community members. And that specific, the Latinx group will take place in Spanish. And we've recruited culturally matched facilitators for each of those focus groups. And this is an opportunity for us to gather input from our local community about how we can best serve them so that we can really develop programs that have specific features to support everybody in our community. And so that's the very first step on a journey for social and racial justice that our community birth center is committed to.
Great. I love that you're building that in. I mean, because as you talked about earlier, a lot of there's culture change and there's policy change, and sometimes one gets out in front of the other. Sometimes they work sort of at the same pace together. Seldom, usually it's one or the other. But that important recognition that a lot of our medical system and our insurance system and our hospital systems have a lot of holdovers in their practice, in their culture from old policy. So even though we've gotten rid of some exclusionary policy language in our healthcare system, the culture and the practices live on and get handed down from provider to provider and over time. And sometimes it's just in how a space is physically set up or arranged or organized. It can be very subtle. So I really appreciate the intention you're putting behind building a culture and a system at the birth center that's inclusive and works not to perpetuate some of those negative impacts. In the couple minutes we have left, I want to make sure, first of all, that you get to say what's most important to you to get out there to the community about who the birth center is sort of for and how people can be involved in this movement. Both the initial capital, campaign and launch, and then ongoing, if you foresee opportunities for people to be involved in supporting the birth center once it's up and operating.
Yeah, thank you. Gosh, who it's for. We talk a lot about pregnancy, we talk about birth, but the birth center is for everyone. And that's because some people are grandparents. Some people don't have children, but they want to come for general health care at the birth center for annual well checkups. And so it really can be for everyone. Some people are teenagers and they want to come in for their first kind of women's health visit, things like that. So this, the birth center can serve a variety of people for a variety of needs. As far as getting more involved and what word we need to get out to the community now, we have opportunities that people can volunteer, and there's a volunteer sign up on our website. Our website is ourcommunitybirthcenter.org. And we also are asking our community members to donate and support this cause. Donations of all amounts are greatly appreciated. And like I said earlier, right now they're being matched by a $10,000 matching challenge, and that's through the end of October. And then I did mention earlier that people can sign up for our focus groups. Those are targeted specifically toward people who have given birth in the past 5 years or hope to give birth in the next 5 years. So if you fit in one of those categories, then there's signing up for our focus groups as a way to help support the birth center. We will continue to have ongoing volunteer opportunities and opportunities to donate once the birth center does open. So that's an ongoing piece of our work. And I'm happy to meet with anyone in the community who wants to learn more, get more involved. And lastly, helping us look for a space, because we really are ready to commit to a space when we find the right spot for the birth center. And if that's your specialty, then I have a list of our criteria of what we're looking for, and I can talk to you more about that.
Fantastic. Thank you so much, AlexAnn. As I said, these conversations always go so quickly, and these issues that we're talking about are complex, right? I mean, it's pretty straightforward what you're trying to do. Find a site, raise the money, open the birth center. But underneath that, when we start unpacking that, like we've been talking about, these issues of equity and access to our healthcare system and health outcomes, and how they're not all the same for everyone in our community, and all the different services that the birth center can be providing in addition to helping people who are actually birthing babies. There's just so much there. So I really appreciate you being willing to come and do the sort of condensed version. Hopefully some folks watching this will follow up with you, follow some of the links to learn more about the birth center. But I'm really excited. This is something, again, one of the sort of core lived experiences and perspectives that I want to bring, and why I'm running for county commissioner, is to bring this understanding of whole health, and particularly the importance of looking at how the health of mothers and children in our community as an indicator of overall community health.
Yeah.
And you're just a wealth of information, and the path towards this new birth center is, I think, bringing some really important awareness to more people in our community about who is and isn't receiving the health care they need, and how it affects all of us in the community.
Yeah, thank
failing
you.
mamas and kids. So thank you so much for being here. Really appreciate it. Appreciate all your work.
Thank you. I think that's right on. That I want to do a study sometime of looking at how having access to the birth center is improving the health of our community long term in so many ways.
Yeah. Great. I'm with you on that. Great. Thank you again so much, AlexAnn Westlake from our Community Birth Center. Thanks to those of you who joined us this morning. Don't forget to get out and enjoy some of this sunshine, soak up some of these late summer vitamin D opportunities. Wear your mask, wash your hands, keep your distance, be good to yourselves, and hang in there, folks. Thanks. See you next time.